I'd like to quickly thank our distinguished panel for making time for us today. And before we start the session, is it all right if we can get a show of hands from the audience? I want to know how many of you have ever fed your symptoms, your lab reports, or you've asked AI, any chatbot, to decipher your medical reports for you. Can I get a show of hands? It's okay, many of us are guilty of it. I know I am. And what if I tell you that, in a recent study that put doctors and AI through the same diagnostic reasoning test. And doctors who were working alone, they scored 74%. Doctors who were using AI, they scored 76%. Would you want to guess how much AI alone scored? A ballpark figure, anyone from the audience? Would any of you like to take a guess at it? Exactly. AI alone scored 90% on that reasoning test. Now, I want you all to just sit with that math for a second and see if by the end of the session, your assumptions are reassured or perhaps your opinion is changed on that.
Okay, but let me come in right there. On a lighter note, everyone please take out your phone and open the AI app that you use and ask the AI one simple question. And I can bet it's going to answer it wrong. Is that a challenge?
Please go ahead.
Please take out your phones, ladies and gentlemen, and ask your AI, agar ChatGPT hai, Gemini hai, Meta AI hai, usse पूछो which are the days in the week that have the letter D in them. How many of you will get the right answer? I hope no one does, because see, this is the paradox. Even if on the same AI platform right now you ask everyone in the room, pick any number between 1 and 50. Did you get the right answer, sir? Tuesday kahan gaya? To galat hai answer. Anyone else? Anyone with the expensive Claude ka $200 wala subscription? Absolutely. Correct. So no one got the right answer because the right answer is all days, right? So acha, now if you type one more question, pick a number between 1 and 50. Everyone's going to get 27. Okay, we'll play these games later, I'm sorry. But let's not give AI too much credit. It is there, and of course, the stalwarts with
Absolutely,
me will discuss
and
more.
we are here to put it to test, which is why, Dr. Naik, I want to start with you, and I just want to understand what kind of conversations are happening around AI in your circles in hospitals, and what is the broader sentiment around it?
So see, AI is a very exciting field, and I have to say that AI is the way we're going to move forward in medicine. And the reason is exactly what you said. The ability to digest a whole lot of information, to digest patterns that we don't recognize, and give out something that is useful. So let me give you an example of how it's being deployed. Imagine yourself sitting in this room like we are, and we have cameras running everywhere. And what if I could pick up just from the camera patients who have a heart rhythm problem? Wouldn't that be fantastic? Yes, we are beginning to do that. And how? Because you are able to train these digital tools into diagnosing heart conditions. Maybe it can diagnose blood pressure. Maybe it can warn a person who has got diabetes. Maybe it can diagnose some other condition. So these things are patterns that hitherto went unrecognized. What if my glasses could help diagnose whether I suffer from blood pressure or maybe some other medical condition? So that's the way moving forward. Similarly, for a surgeon, he's a robotic surgeon, or maybe somebody's doing abdominal surgery. What if the robot can diagnose, oh, there's a lump over there that needs to be addressed that was missed on the CT? So all those things are coming up. So it's a very exciting field. But at the same time, we have to recognize there'll be a lot of other challenges that come in, especially like the one Arjun just said, that there'll be misdiagnosis, and we have to be warned of that as well. So it's the way forward, but yes, with humans will remain in the loop.
Absolutely, and the scenarios that you mentioned, it does In fact, it does not seem that it's out of a sci-fi movie at all, because these are very real conversations we're having on platforms like these. My next question is to Dr. Akbar. Dr. Akbar, do you have patients who are coming into you, with diagnosis from ChatGPT, convinced that they've figured what the problem is, what the cause of the solution is, and how do you tackle people like that?
Okay, coming back to the first statement you'd made about that study, 74, 76, and 90%. Those doctors, unfortunately, I don't think they had OC. AI is artificial intelligence. OC is original common sense. Just add those two together, those numbers will go up dramatically. You'll probably get 98 or 99. I look at AI like umpire's call. If it's hitting the stump a little bit less than half the ball, it's still umpire's call, it's out. But there's some human aspect to it. But unfortunately, we don't have only 2 or 3 DRS reviews in our OPD. Everybody, infinite DRS reviews, everyone comes with a DRS review, and it becomes problematic. And our OPD consultations go longer and longer. I'm sure sir also would agree with me, and many of the other doctors in this August gathering would have had this meme passed around that doctor consultation alone 500, Google plus Google 1,000, AI please come after 3 months with 3,000 deposited pre.
But we often joke about Dr. Google, Dr. ChatGPT, but do you think there's a meaningful difference between an uninformed patient and a misinformed patient? And do you think that the patient who is using ChatGPT, they might not have the right diagnosis, but are they perhaps asking better questions? Because I would assume that must have helped make the patients more medically literate, at least in some sense. Do you see that shift happening?
A huge shift happening. People going for master health checkups because they've just become far more approachable in urban centers. Master health checkups have become a lot less expensive. People are getting those tests done, and they're feeding it directly into these platforms, and they're getting a host of diagnoses out of that. It's generating a lot of angst. And suppose if it's somebody who's come from a distant area and they've done the test and they're going back to their hometown and they upload it, and the GPT, it suggests that you do further testing, like a nuclear scan. It's not available there. And it generates a lot more stress than that is necessary. Many a times, as Dr. Dang had already mentioned, the answers are not so replicable. Till we get to that point, these are evolving platforms, and it's generating preformed transformers, GPT. So all the time it's evolving. You're not going to get the same answer every time. You're going to get evolving answers because data is continuously being fed in. So it should be used with original common sense, and I think that's the way forward.
Well said, Dr. Akbar. Now, Dr. Luthra, you've spent a considerable time integrating robotics with data and highly personalized scanning, which surgical planning into your practice. When you look at the operating room today, where do you think technology has made the most genuine improvements, and where do you think that human judgment still remains sacrosanct?
Yeah, so a very good question. So when we integrate robotics or AI with surgical parts. So what AI is doing, we're doing pre-operative CT scans for our patients, which you're not doing when I'm doing a conventional surgery. So a robotic surgery implies that you do a CT scan. That CT scan, we get a 3D segmentation of the scan. We get a 3D bone model before we actually do the surgery. And on that model, we do sizing of the implant, what size of the, for example, for the hip replacement, what size of cup, what size of stem will fit the patient. We do know that before we start the surgery. And we do a virtual surgery on the computer before we actually doing a surgery. So we see the whole range of movement of the joint, whether the joint is going to dislocate at a particular angle. And if it dislocates on the software, then we can do some changes in the implant placement in terms of anteversion or inclination, so that it becomes a joint which is very stable. And then the same thing we help put into the robot, and the robot is helping us in performing the same pattern what you've decided. So what is helping is making me sure that what I want to do preoperatively, and then we plan and then we execute. So right from planning to execution, everything is streamlined and we get exactly what we want. So some patients ask me, the doctor, I've suggested a robotic surgery, and they come, doctor, if robot is doing the surgery, what are you going to do? they think that the surgeon is going to sit and have tea in the corner while the robot is operating. It's not like that. The surgeon himself is in total control of the surgery. Robotics, I would say, is a tool which is guiding the surgeon in doing the surgery in the right manner. It's like using Google Maps. So it's giving you and showing the way, but the surgery itself is performed by the doctor. The doctor can overrule the robot anytime he feels that something is going wrong, because robot does not know the tissue tension. He does not know the soft tissue release, because this is all, robotics all, like Dr. Dang also said, it's all data which we've given in. And it's not applicable to all patients. Some patients would have a vascular abnormality. It's not same everywhere. So the surgeon is still in control, but robotic is making the surgeon smarter. So it is human intelligence plus artificial intelligence plus robotics, which is the way to go forward. We cannot deny robotics from our life, and it's here to stay. We should adapt it to become better surgeons, better doctors, to implicate it in our day-to-day life so that we get better results.
Right, and that is the sweet spot. But at the same time, from what I'm picking up, personalization remains a deeply integral part of your process. And of course, the other promise of AI is reducing the diagnostic errors and identifying disease early. Dr. Dang, do you think AI can genuinely help close the diagnostic gap? And of course, in a country which is as diverse as India, as in fact, Dr. Akbar had also mentioned that getting access to your metro cities is one thing, but tier 2, tier 3, where the tools might be now coming into the conversation, but perhaps the technologies and the right, medical care is still a far cry.
So I think this is a very relevant question, and before I begin, I want to thank today's organizers for having us with such a prestigious panel with me. So, the way I look at the role of technology when it comes to diagnostics is probably going to be explained by two very common things that all of us experience. Now, everyone that I see in the room right now, how many of us have actually, for ourselves or one of our family members, our parents, children, wife, or whosoever, gone for a standard kind of quote-unquote test package at a lab near us? Most of us, right? So now, it's actually a paradox. When we talk about the world, about personalization, about preventive diagnostics, how can two people of the same age and gender have the exact same test requirements? That is absolutely not possible. Hypothetically, if 4 of us are, say, 30-year-old males, one might have a health goal, like I have a health goal of weight loss, whereas someone else might have hair thinning, someone else might be planning a family, so they want sexual wellness, whereas someone else wants to work on their sleep and mood. So everyone has a different health goal. Someone is probably having a beer every day, so they definitely need a liver function test, whereas someone is going to the gym for 4 hours in a day and having a lot of creatine and protein, and they need an extended kidney function test. Someone's parent has uncontrolled diabetes, so they need a deep dive into blood sugar, HbA1c, cystatin, microalbumin testing. So essentially, right now, when we go into a lab, we are picking a package based on 2 things, considering we are not from the medical fraternity. And the first one is our basic medical knowledge. कि अच्छा एक डायबिटीज़ का टेस्ट कर दें, या अच्छा एक लिवर वाला भी ज़रूर कर देना, एक हीमोग्लोबिन ऐड कर देना भैया. Second is, of course, our budget, right? Where we want to spend 2,000, 5,000 or 10,000 and pick a package based on that. Now, to circumvent this one-size-fits-all issue, we actually launched an AI-backed website 4.5 years back that is free for use for everyone. It's called discoverbydradangs.com. You log into that, the AI asks you your health goal, prompts a few questions, and then gives you a scientifically backed, curated test package where every test has a peer-reviewed publication to show which test you need and why you need it. So if we say there is a 40-year-old male in North India who's a vegetarian and needs a vitamin B12 test, then there is an article to actually back that up. So I mean, today when we are in this era where everything is so cookie cutter when it comes to diagnostics, it's something that we genuinely lost sleep over. And of course, AI and technology was a great example on how we circumvented that. And of course, I've always believed that I would like to conclude by saying AI should be E4 to make health P4. So your AI should be E4, the 4 E's stand for ethical, equitable, evidence-based, and explainable. For health to be P4 is personalized, preventive, predictive, and participatory. So I mean E4 for P4. I mean, that is my moral of the story.
E4 for P4. That's understood, Dr. Dang. Very interesting points there. Now, we understand that there is a certain layer of skepticism when it comes to AI. We know it's not where it has reached a point where it can do those remarkable revolutionary stuff, but it's definitely in the process. Now, in the same breath, Elon Musk recently argued that AI and robotics will eventually outperform doctors and surgeons entirely. And we know what AI is capable of. We've gotten a small glimpse from all our panelists. Dr. Naik, do you think that possibility can ever materialize where AI can completely replace a doctor? I know it'll probably replace me first. Journalists would be gone, but doctors, do you think perhaps would be the last in line?
See, I don't think so. We can see a condition in which AI will be completely autonomous, and a robot will be able to completely supplant a surgeon, and the surgeon need not be there. That would be fictitious because there are many things that need a human intervention. And although AI, the robot can certainly help assist performing tasks, but we have certainly not reached the stage where they can become completely autonomous and completely perform surgery without any human intervention. But we should realize that AI is a tool that has to be employed after using it's a correct basis. Because there are umpteen examples where AI can cause hallucinations. AI can fictitiously bring out diagnoses and suggestions which are completely incorrect. Let me give you a very pertinent example of what was done a few years ago. Somebody from one of the universities abroad deliberately planted a fake article into the scientific journal. It was a deliberate attempt. It was a disease called, I wonder if you know about it, it's quite famous amongst our community, a disease called Biksuni mania. The name is incredulous. There's no such disease whatsoever. An article was deliberately planted into the scientific press that there is some such disease, or its symptoms were written, and this thing and that thing. So just one article. And it took just 2 years for AI to generate a whole lot of literature behind it. And so in fact, once AI recognized this as a condition, it autonomously created a condition that, this is the disease prevalence, these are the symptoms, this is how you should recognize this is how you should treat it. And if you Google it now, you'll read about it. So, you cannot completely depend on AI because, AI comes from a whole lot of sources. Remember that health information is information that if it has to be used for generating any sort of background knowledge, it has to be from medical journals. But if AI is taken from social media, it is taken from the lay press, then its interpretations, it's whatever discussions it may form around it will be completely incorrect. And one last example that I'll give you is of how one AI generated model completely made a wrong set of diagnoses for a group of patients. There was one hospital located in a place A, and another hospital that was located just 2 kilometers away, hospital B. So in hospital A, they looked at patients who came to the intensive care unit. They looked at what diseases they had, what findings they had, and based on that, they made a risk score that if you have these conditions, then you have you need this treatment or that treatment or this thing or that thing. So the whole AI-based algorithm was made to manage patients who came with that condition. And when they validated that model, they said, hey, let's apply to this other model, to this other hospital, which is across the road, and let's see how well it works in diagnosing a condition, in giving out suggestions on what treatment should be done, what follow-up should be suggested to that patient so that they don't have problems in the future. It didn't work at all. It could not diagnose a single condition. Its usefulness was completely useless. Its utility was useless, and it had to be abandoned. And why was that? Because hospital A had a different set of patients. They had a different background. They had a different age. They were from a different community. Hospital B had a different set of patients. They're from, again, a completely different background. So, the utility of a model will only apply to the condition, to the patients on which it is based. And therefore, a model made in North India may not work in South India, and may not work in East India, and may not work in West India. So these models will be fraught with problems if they're not based on the population for which they are designed.
Right, Dr. Naik, please,
sorry.
Dr. Lewis.
So can I add, with due respect to Elon Musk, what his predicted is based on cognition, not on computation, not cognition. So AI is all computation, while our science, health is all cognition. So we cannot replace cognition by computation. Certain branches like radiology or pathology or dermat, they are pattern-based specialties. So here the AI plays a bigger role, and I don't agree that it will totally replace the doctors. But other specialties which needs cognition, so that are very hard to replace by any AI, because cognition is only by human being. No system built whatever way can do cognition by a person. That human touch or the moral sense which the surgeon has or a clinician has by checking the patient, by touching him, by checking him clinically, so that will not be done by the AI.
Absolutely, and doctors like you have the right tools and the skill set to make that differentiation. But for audiences like us, we live in a time where we've never had this amount of information at our fingertips, and yet it has never been so difficult to find credible information. That is the world we're living in. But Dr. Akbar, now coming to you, as we were discussing earlier in the opening as well, that healthcare has followed a certain sequence for the longest time. You have a disease, you get it diagnosed, and then you go for treatment. Now, if AI proceeds on the trajectory that it's on, and prevention, we've always said prevention is better than cure, and if now that is materialized, what happens to the hospital economics, and how do hospitals adapt to this change?
Okay, you're asking a preventive cardiologist. I really try to prevent people from getting to the hospital. And I think that's the best way forward. Even hospital economics, because you're going with the trend. You're going to shake hands and improve your ethical practice. And that's what is the touch and feel of medicine. There is the science of medicine, which we learn out of textbooks. And then there's the art of practicing it. And that becomes all that more vital when you're able to do a good outpatient department, when you're able to do good preventive medicine. And that's something which I feel AI has helped. When you do load up these tests, usually it's smart, it's evolving, so it's able to see which answers are getting more reads. Obviously, those answers which can be followed up, which can be easily implemented, like lifestyle modifications, dietary changes, implementations on exercise, those things the patients can do, or at least they can tell their elders, or they can tell their family members, and that gives a lot more screen time. AI knows that, so it'll suggest that first. And that, I feel, is a boon from the AI sector. And as far as the hospital economics goes, treating patients who have definite disease is far more validating, more joyful than treating people who have marginal disease or don't have much disease. Unnecessary investigations are avoided, unnecessary questions, litigations, lawsuits are avoided. And I think that gives you a lot of mind space, because if I have a smile today as your doctor, you're going to trust me for tomorrow as well.
That's really reassuring for all of us in this room here. Now, Dr. Nang, as Dr. Naik was also mentioning that a particular treatment or a particular approach which might work in North India may not work in South India, and same goes for East and West. But we understand that compared to many developed countries, India still faces a shortage of doctors. We have one doctor for roughly 800 patients, if I'm not incorrect on that. And this, alongside persistent gaps in access, Do you think AI would be able to democratize access to these systems?
So, partially yes, but of course with that human oversight that is required. So I think access in a scalable specialty, like what sir was saying, like perhaps radiology or pathology, I think is far more doable, or at least what we see in the immediate future. So right now we have remote reporting that is across countries or states or cities without any geographical boundaries, is something that has leveraged super specialist care even to the remotest of places. So I mean, if there is a particular hospital or a tertiary care center where they are doing a particular surgery, there's actually a certain kind of specialty known as a frozen section, wherein the patient is on the OT table and the surgeon has cut open the patient, and then they really see something and they're confused whether it's cancer or not. And that is the time when they take a little swab from that sample or a little biopsy, and the patient is under anesthesia. And that sample goes to the lab, and they ask the pathologist within 30 minutes to tell them that is it malignant or not. Because if it's cancer, then of course they have to cut out a lot more and take the entire thing out. So now with frozen sections also, when there is a specialist pathologist who's not available at that tertiary care center or hospital, what AI helps us do is that digitize that particular slide, send it to a Delhi or a Bombay or a Hyderabad or a Bangalore or wherever that pathologist is, triage the case, give a differential diagnosis, but the ultimate stamp of diagnosis, of course, comes from the human mind only. I mean, like all my fellow panelists have said today, I would like to reinforce that of course AI is a tool. It's like a very, very effective nurse. But again, I mean, the final decision has to be with clinical oversight. On a lighter note, since everyone is using AI, just 4 days back, our customer care had got a call, and this elderly lady who's 85 years old, and she was screaming at the top of her voice, and she was saying, I want to speak to Dr. Dang right away. I'm very angry. And then, of course, it escalated to me. In 10 minutes, I called her back, and I was like, good evening, ma'am. I'm Dr. Dang speaking. How can I help you? So in Punjabi, she said this, but I'll translate into English. And she said, "Twadi report galat hai," as in your report is wrong. And I was like, ma'am, why would you say that? She's like, no, you know, I'm third generation. My grandchildren also come to you now. But today, your urine culture report is wrong. I was like, ma'am, please tell me what happened. I'll just open your report. She's like, no. You've written I'm sterile in that. And ChatGPT tells me sterile means that I've never had any children. Main to 4 pote haige. So, you know, if you don't prompt or use AI in the proper sense,
Right.
I mean, it can go haywire. So, I mean, I would like to end on that note.
You, Dr. Dang. And now shifting focus to Dr. Luthra, we understand that India doesn't simply face a shortage of doctors. It is, of course, a situation, it's also a distribution access problem that we have, and some of our best specialists, some of them that we have on the panel here today, most of them are concentrated in the metro cities. People don't have, access to quality healthcare. What do you think? Would AI be able to help in that? And another question that I'm very curious to ask of both of you, at least, you've increasingly mentioned, disciplines like radiology. Would you have some advice for students, young professionals who might be pursuing careers that you think might become obsolete or easily replaceable in AI going forward? Just picking up on the conversation we've been hearing here today.
That's a difficult question, so I should not discourage. But yeah, if you look in the future, I think these specialties, especially who are pattern-based specialties, would be caught up easily by the AI, and maybe it would replace to a certain extent the doctors who are not interventional radiologists, but the typical basic radiologist will be replaced by the AI very soon. Because AI is coming in a big way. And coming to the second part, the second question, but the first question you asked was, how do we integrate into the periphery? How do we get the AI helping us? So I think AI, in the sense, what AI will help us is, for example, in a village or a smaller setup where there are no special doctors. So what AI can do is it can help in screening or funneling these patients And for example, there are thousands patients in a village, 1 lakh, population of 1 lakh in a village. Out of that, the AI can actually screen out or funnel out, maybe there are 1,000 patients with osteoporosis, which needs attention. So these then the doctors over there who are not very keen, so that they can actually start treatment for these patients so that we can start preventive, as we spoke about preventive, so that we can prevent fractures in such patients by starting early treatment. So that's how it can help. And the second way is these centers which are small, which if we integrate AI to these centers, what it can help us is it can help the primary care doctor to actually refer these patients to the tertiary care center and quite early, so that, for example, for a cancer patient, if the patient is referred early, we can save the patient in time. So, and that's how it will actually create a big impact.
Right, and it is a delightful conversation, and I wish we had more time. But quickly, I just want to get your opinions before we wrap up. If we were having this conversation, let's say 5 years down the line, now what is that one breakthrough in AI, robotics, or diagnostics, or even digital health that you're most excited and the most hopeful for? Dr. Naik, why don't you start?
Well, I think one of the exciting things that will happen in robotics and in surgical fields will be creation of digital twins. For example, when we do a complex arrhythmia surgery in patients, we are working on hearts that are barely functioning. We have abnormal heart rhythms that may be located in an area as small as 2 millimeters. And to find that from a catheter that is about 150 centimeters long is often a challenge. And therefore, precision will improve greatly if the doctor is well informed prior to the procedure as to where he should go. He can perform that procedure faster, better, and give a more effective outcome. So I think, yes, robotics and AI are something that are going to be integrated into our practice, and we see us delivering even better quality care in the coming years.
Noted, Dr. Naik. Very interesting, but of course the trade-off for that is how much access are we as a society willing to give, because digital twin is ultimately you're giving up all your vital metrics, and of course we'll have to see if that is something that society as a whole would be willing to trade for something which is as important as life or death.
What I mean by the digital twin is for surgical procedures, and that not for trading information. When you're trading health information, that, like you rightly said, is going to be a major challenge.
Right.
Because when you start sharing personal reports on the net, we have to, there's a lot of personal data that goes out, and that is a major challenge for data privacy, and that will be the next hurdle to cross. There are some specific sites that are trying to look into it, but yes, that challenge is still there.
Right, Dr. Naik. I'd like to extend the same question very quickly to you, Dr. Akbar. What are you most excited for?
So, predominant practice is in rural Tamil Nadu. It's in a town called Ambur, which is famous for biryani. We have a doctor-patient ratio of 1:11,000. That is, doctor-cardiologist ratio is 1 is to maybe 10 lakh population. I'm the only visiting cardiologist in that region. So, low tech, easy accessibility, AI is something which is the need of the hour over there. So voice-based recognition protocol to identify breathing patterns and speech patterns to identify even respiratory disease, heart disease. These things are algorithms which are evolving. And I think for prognostication, AI is a good screening tool at the current level of excellence, the current level of tech. I think as a screening tool to direct them towards the right rational next step, I think AI would be a very good tool.
Noted, Dr. Akbar. Now, that's unfortunately all the time that we had, but we'd love to continue this discussion after this panel. Thank you so much, all of you, for joining us on the panel and sharing your wonderful insights with us. Ladies and gentlemen, a huge round of applause, please.
Thank you. Thank you.